and how difficult it is for people to die alone, isolated cruelly by COVID-19. I can't imagine what it would have been like to not be able to visit my mother as she died. It's tragic to think that we can't be with our loved ones, even as they pass.
That's Travis County Judge Sarah Eckhart opening up today about what some families are facing during this pandemic. She says it's difficult to isolate vulnerable nursing home residents, but she explained health officials are doing the best they can. One family tells KXAN Investigator Avery Travis they're worried about a loved one who they say tested positive and may not be isolated. They say they believe she's still sharing a bedroom with another resident.
Just a few weeks ago, Robbie Barber and Regina Mackey went to visit her mom through the window of her room at her Austin nursing home. KXAN has confirmed cases of COVID-19 at Riverside Nursing and Rehabilitation Center, but the facility hasn't said how many.
We want to come see you, but we can't because of the virus that's going on. We can't get in a nursing home.
Since then, they've been talking to Corinne Mackey on the phone. On one of those calls, she told the couple she'd been tested for COVID-19.
Shocked, disturbed.
But Barber says what was more disturbing, even after she tested positive, Regina's mom still talked about having a roommate. CDC guidelines recommend residents with or even suspected of having COVID-19 be placed in a private room with their own bathroom. They also recommend isolating any former roommates who might have been exposed for 14 days. But Texas Health and Human Services says if necessary, homes can group residents who've tested positive and utilize semi-private bedrooms instead. They do urge facilities to dedicate a unit or a wing for COVID patients. But the World Health Organization says we don't know yet if patients can catch the virus a second time. That's what has Barber worried about the possibility of Corinne sharing a room with any other resident.
I'm standing here with a KXAN news reporter, and I'm calling to verify who is in the room with Corinne Mackey.
They called the home to try to get some answers.
Thank you for calling Riverside Nursing and Rehabilitation Center.
When they finally got through to the nursing home director,
He couldn't give a straightforward, direct answer. It was, they doing it according to state procedures, according to HHSC. And then at one point, he also stated that if a person is positive for it, they can't get more positive.
Barber asked if that means Regina's mom is sharing a room with another positive patient. But he says the director wouldn't share any more details in order to protect the privacy of other residents.
Very vague.
We reached out about Corinne Mackey's case, and a spokesperson for Riverside told KXAN they're following all CDC guidelines, including isolating positive residents in an isolation wing cared for by staff who only work on that wing. We asked them to clarify, could those patients still be sharing a room with another resident who's tested positive for COVID-19? And the spokesperson's answer was simple, no. But Barber says after his conversation with the facility, he's more confused than ever about how the home is caring for Regina's mom.
The frustration is built back up. I got mad again because they're not giving straightforward, clear, direct answers, either a yes or a no.
Avery Travis, KXAN Investigates.
New numbers from the state show nearly 480 residents in long-term care facilities have died from COVID-19. We are tracking confirmed cases of COVID-19 in nursing homes. For the latest map and previous nursing home coverage we have, look for this page under the Investigations tab at KXAN.com.